This program is proudly brought to you by Dragnet, your #1 online pharmacy, and the Pharmaceutical Society of Ghana, supported by Seafort, your best vitamin C supplement from Samuel's Pharma.
Hello there, we are super excited coming your way with another thrilling episode of Ask Your Pharmacist. My name is Peggy Samuel. This show is proudly brought to you by Dragnet, your #1 online pharmacy. Go ahead, download the Dragnet app on Google Play Store, the App Store, order all your medications and have it delivered to you. Remember, with Dragnet, you are definitely assured of quality, convenience, and affordable drugs. Dragnet, your #1 online pharmacy. This is also brought to you by the Pharmaceutical Society of Ghana and Tema Christian Eye Center. If you are looking for a one-stop shop that can cater for all your optical needs, you need to visit Tema Christian Eye Center at Tema Community 1, adjacent St. Paul's Methodist Church, or you can reach them on 024-371-7468. Tema Christian Eye Center, changing lives through proper eye care. This show is supported by Seafort, the best vitamin C plus zinc from Samuel's Pharma. Many thanks to our media partners, ETV Ghana and GH1 Television. We are going on a quick break. Do not go anywhere. We'll come back and the show definitely continues.
Are you tired of roaming for your medications and can't find them? Sick and alone and can't get anyone to get your drugs? Do you need to talk to a pharmacist? Or do you feel uncomfortable when buying certain drugs from the pharmacy? Do you want your drugs to be delivered to you at the comfort of your own home or office? Then it's time to download the Dragnet app, spelled DRUGNET, from the Play Store or the App Store to enjoy total convenience. Use Dragnet, your #1 online pharmacy. For further inquiries on Dragnet, call 02400244455.
Memamo akwa badeba Tema Christian Eye Center a share enihu apomudin sam nyina seye akwala seye penyin yewo a doctor for kukudam a wombe to womobo ayem pensem mu nhwehwemu ansana yehu nia eha weni no yaye ne se seye de boa ma wonso weni ne ho tono yewo nro apapapa ewa ha a chese ye hwe wi a ubenya ne nyina bi wa ha se efa no ahwehweniwa a friend lenses enso a your quality lenses, any frames.
This center is devoted to eye care. We treat patients with all types of eye diseases here: cataracts, glaucoma, refractive errors, and retinal issues. I am a glaucoma specialist here at the Tema Christian Eye Center, seeing patients particularly with glaucoma and cataracts.
Yeah, war Tema Committee 1. Ye be Methodist sorry no. Ye juma fiti ajwada Monday kopem memninda Saturday.
Tema Christian Eye Center, changing lives through proper eye care.
You are welcome back. You are still watching Ask Your Pharmacist, and today we are coming to you from La, here in the Greater Accra region of Ghana, and our guest pharmacist is Pharm Dr. Seth Ofei-Kweku Jr. He is a clinical pharmacist at the Kolebu Teaching Hospital, and our topic for discussion is conjunctivitis, aka or locally known as Apollo. Pharm Doctor, how are you?
I'm good by God's grace. How about you?
I'm doing very well. Nice to see you today too. So what is it about Apollo that we need to really be doing this today?
Okay, so conjunctivitis, that is locally known over here, is what we call the Apollo, and this is a highly contagious disease that usually affects the eye. So it affects the conjunctiva, what we know as the translucent membrane of the eye that usually covers the white part of the eye and also the inner part of the eye. So when you have inflammation of that membrane, then you have the condition that we call conjunctivitis. So that's what I can say about it.
Well, so it's highly contagious. More to the reason why you need to stick through.
Apollo yare intin pese me de anymore na bia wo question bi same na me ya no mo.
Apollo nu eba uye de na ube hu say Apollo na e ha.
enti no Apollo ne yare bi a emu anketenkete bi a from virus na edeba sana coronavirus yi sana virus edeba no na wonya Apollo na de tie ne se woni etumi eye kokko woni eye red ana se abrofo mu kan pink eyes na afi so no insuo ebefi woni insuo esase fi woni ase eba na eba woni so ahyehyew nti wonya we bi out mu se wonya Apollo symptoms ni bi no sanity
Apollo ni question ni mi pisa Apollo ni ma yare mo yare na enam baby enyum na batum usu ebia unam sa awo huna me disket ti se unam ana wotipo apa ti se unam ewiem se no uti apa yare let me ba hu every time.
Okay. Intimate to asia person say ya ne ya bia ha na about so na and the tie ne say I am one can get be from virus and then I dey Apollo ne ba inti ebia say infection and our virus ne bia woni so inti no say edwima woni prunsuo inti woni prunsuo na say me so minim saka insuo no na say me komani a ebetumi say me smile den menya Apollo ne bi inti no bia na say me ben wa either say me saka directly and say indirectly I can also affect myself no me bi inti sanity
me de Apollo de minim ni say Apollo ya wa at times apunsuo ne yedi guso na apunsuo no yedi gu ye ni so a aya eboa eye because ade nkofo bebre ejidi say apunsuo no wodi guso a eye na mom wo ya pharmacy na mpese busa say eye ma yen say yedi gu ye ni so na
okay usually no Apollo no idea ya ka say cause virus in one get na eden in edeba and I say impo no so one yen hwimpo any specific treatment dia ho nti impo no say one yen hwimpo e no nkosa wo ha body na nkosa be den e be fight na iron amana akọ maybe wo so ayede hydrobia no artificial tears insue in eden in edugo so ebu wo say the ndrobi to say edrobi fen antihistamine edugo so in ebu pa itumi de e bia material be na ntoma bia e clean ebo fen say insue mu e de ka woni no na ebu na was some discomfort ebu na woni no Apollo na ba na ebu woni na ekoko eprunsio eya wo ya na wo de ntoma no ebu nsio na say wo de ekata woni no so etumi eden eboa nti na say wo de epunsio no eno si nsio saa e de fa woni no so a de eche ne say wo de fa woni so na ama akoye say de wo de natural tears no egu woni so no na eno no say wo ha say na meka no body na ngasa be eden e fight virus no nti with time bi wo ha eno ngasa be eden e be ko usually within 1 week no obehu effect
nti apunsuo no enya ma say edigu ye ni so enya ma yen say edigu ye ni so because you say enchine ni ma bi wo mte bet ma fight virus no enti na be ya akwafa ko recommend say ya fa ngu ye ni so no
eno enya ade a e fight ekum emo no but the chene say e bia ne betimi de comfort bi e betimi ma woni na e hyehye no insuo na epro no eden abrase na ne betimi aboa but ya na ngasa ya kana bof kasem say self limiting and ngasa how body na ngasa be den e fighting off e ma ne ko all the insuo na so will provide some sort of comfort bi na yen say bia bibi wo insuo ni ma tu mo na e cause Apollo no sanity
me question na ne say but some me bisa say in case Apollo yo bia na Apollo ye mia edobe pot na wo say nipa ne fa na memfa
enti no nukreni de tie ne say omuni yenu drop pot bia wo ha ye de ema Apollo no but for customer and science customer you are be can say you are self limiting into the body nankasa no naturally no fight yare no until within some few days and as up to 1 week be no betumi at all maybe because of burning sensation at the bar no any discharge no any redness no your eye drops be high friend no antihistamine it me the man amount some comfort and I say it do be so high friend no artificial tears and so the good in so and no so sometimes yeah be friend no cold compressors be out to be clean a cloth be bones you ne other two so provide some sort of comfort but nangasa wa e be healing yare no intended treatment ye de boa no
Memamu akwa badeba tama Christian Eye Center a share enihu apomudin sam nyina seye akwala seye penyin ye wo a doctor for kukudam a wombe to womobo ayem pensen mu nhwehwemu ansana yehu nia eha weni no ya ye niese seye de boa ma wonso weni ne ho to no yewo ndro apapapa ewa ha a chese ye hwe wi a ubenya ni nyina bi wa ha se efa no ahwehweniwa a friend lenses enso a yewo quality lenses any frames.
This center is devoted to eye care. We treat patients with all types of eye diseases here: cataracts, glaucoma, refractive errors, and retinal issues. I am a glaucoma specialist here at the Tema Christian Eye Center, seeing patients particularly with glaucoma and cataracts.
Ye wo Tema Committee 1 ye be Methodist sorry no ye ejuma fiti ejwada ye Monday kopem memninda Saturday.
Tema Christian Eye Center, changing lives through proper eye care.
Hey Kofi, are you coming to the party? Everyone is here.
Oh, Mido, I'm not well low and I feel too weak to go out and get drugs.
Oh Kofi, why the hassle? You can order all your drugs on the Dragnet app.
Dragnet app?
Yes, Dragnet app. I don't stress myself any longer. I just go on the app and upload all my prescriptions or call the pharmacist on the app and my drugs are sent to me at a fee of only 5 cedis.
Wow, this is amazing. I feel better already.
It's time to download the Dragnet app on Google Play Store or the App Store and enjoy total convenience.
Dragnet, your number one online pharmacy.
Alright, fam. So first of all, I would like to know, or our viewers would definitely like to know what conjunctivitis is.
Okay, thank you very much. Conjunctivitis is an infection, okay, that usually affects the eye. So what happens is that there's an infection or there's an inflammation that is occurring or happening to the conjunctiva, and that is usually, it comes with the side effects that you usually see. That is the redness of the eye, the watery and all that. So that's what I can say about conjunctivitis.
Okay, so do we have any types of conjunctivitis?
Okay, yes, we have types of conjunctivitis. We have the viral conjunctivitis, we have the bacterial conjunctivitis, we also have the allergic conjunctivitis and also the irritant conjunctivitis. So depending on the cause, then we associate the name with it. So today we'll be looking specifically at what we call the viral conjunctivitis, the one that is caused by a virus.
Okay, so tell us more about that one.
Okay, so with viral conjunctivitis, like I've already said, it is an infectious disease that usually occurs or happens to the conjunctiva, and this is usually caused by a group of viruses known as the adenovirus, especially type 3 of that. It can also be caused by the Coxsackie virus, and it can also be caused by sometimes by the SARS-CoV-2 virus. So it can also be caused by that.
All right, I'm glad you did touch on the causes, but are there any risk factors to this?
Okay, so what happens is that if someone has conjunctivitis, someone has the viral or the bacterial type, that is highly contagious, but the person has the other types which are not contagious, like the allergic conjunctivitis or the irritant ones. But with the viral conjunctivitis, what happens is that because it is highly contagious and it also affects your eye, if I come into contact with the eye secretions, that is directly or indirectly, then I may expose myself to it. So these are some of the risk factors.
Okay, so how would somebody know that they have viral conjunctivitis? So let's talk about the signs and symptoms.
Okay, usually with the signs and symptoms, the person will have the redness of the eye that you usually see. The person will also have the discharge of the eye that we also see. But it is very similar with what we call the bacterial conjunctivitis, in that the signs and symptoms are very similar. But with bacteria, you see that there's ulceration in the person's eye. The person, as in the person has sore. Okay. There's sore in the eyes. The person can also present with this mucus discharge. Okay, that is what you can see with that is the difference between the virus and the bacteria. With the bacteria, you are getting the mucus production, you are getting that ulceration or the soreness that I'm talking about. But with the bacterial conjunctivitis, what happens is that there's redness, there's watery discharge, there's burning sensation that the person usually feels. So these are some of the typical symptoms that is associated with the viral conjunctivitis.
All right, so which one is more popular?
Which one is more popular?
Yeah, viral or the bacterial?
I think the viral conjunctivitis usually has about an incident case of about 90% or more. So it usually happens in the adults, whereas the bacterial one can also happen in in children. But sometimes, depending on the season, we can look at a type like the allergic conjunctivitis, where, let's say, depending on the rainy season, or maybe there's a seasonal thing, just like people with conditions like asthma, may have. So it can come from pollen or something. So when you have that seasonal thing, you can have the allergic conjunctivitis that is not as infectious as the viral one that we are talking about. So this is not a seasonal thing. Once you come into contact with the virus or anybody exposed with the virus, then you can also infect yourself.
All right, quick one. Is it easy to, because sometimes when people see any discoloration in the eye, they tend to think it's jaundice. So is it possible somebody might mistake that for jaundice?
Okay, usually with jaundice, what happens is that if you have jaundice, some of the first clinical symptoms that you see is the yellow discoloration of the eye.
Yeah.
Then you also see that on the skin. But with viral conjunctivitis, you're not going to see that yellow discoloration. You're going to see the redness. Typically, it produces the redness, the discharge, and the burning sensation that we've already talked about. So you're not going to get anything like the yellow discoloration of the eye.
All right, this sounds very exciting, but we have to take a quick break, and definitely we'll come back and talk about treatment. Stay tuned, we'll be right back.
Hey Kofi, are you coming to the party? Everyone is here.
Oh, Medo, I'm not well low, and I feel too weak to go out and get drugs.
Oh Kofi, why the hassle? You can order all your drugs on the Dragnet app.
Dragnet app?
Yes, Dragnet app. I don't stress myself any longer. I just go on the app and upload all my prescriptions, or call the pharmacist on the app, and my drugs are sent to me at a fee of only 5 cedis.
Wow, this is amazing. I feel better already.
It's time to download the Dragnet app on Google Play Store or the App Store and enjoy total convenience.
Dragnet, your number one online pharmacy.
Thank you so much for staying tuned. You are watching Ask Your Pharmacist. We are still discussing viral conjunctivitis, what you would definitely call Apollo. So Doc, we left off talking about, the signs and symptoms. Quickly, let's talk about prevention.
Okay, so with prevention, like we've said, with the viral conjunctivitis, it is highly infectious. So what happens is that if you have it, then I'm more likely to also get it, depending on what we do. So if you have it, you are more likely to, produce it, to have the redness and to have the discharge that I'm talking about. So once you have it, you have to just keep personal hygiene. You have to wash your bed sheets. You have to try and sometimes even put this cloth, soft cloth with warm water. You can also apply it to the eye if there's any discharge, just to clear it off. And so it's basically about you protecting, implementing personal hygiene, and also me taking care of myself, trying not to come into contact with it. So once I come into contact with it, whether directly or indirectly, I may also expose myself once I'm in contact with the virus that causes it. So it is you practicing your personal hygiene, me practicing my personal hygiene. Sometimes, because it is likely that you touch your face, I'll touch my face, you have to be washing your hand with, soap and water, and you have to, practice the personal hygiene that we all know about, just to protect yourself and also prevent others from infecting them. So,
can sunglasses help?
Sunglasses, sunglasses could help, because once you are wearing sunglasses, it means that you may not have direct contact to your eye. Okay. You may not have direct contact with your eye. So it can also help in a way. So using sunglasses is not bad at all in trying to prevent others from also catching the virus.
Okay, Doc, so walk us through the complications of this viral conjunctivitis.
Okay, so because this one is a viral infection, you can have what we call the bacteria super infection. So you can have the virus infection and go ahead to have that bacterial infection. Sometimes you can even have chronic infection. You can have something called cornea ulcers. It can affect your cornea. Sometimes it can even cause blindness at end stage disease. So these are some of the things that it can cause. These are some of the complications that it can happen with viral conjunctivitis.
All right, so Doc, let's talk about treatment. All right, I know and I hope this is treatable.
Yes, this is treatable. What happens is that with viral conjunctivitis, there's no specific treatment for viral conjunctivitis. What happens is that we can treat it or we can manage it symptomatically. What we mean is that based on the symptoms that the patient is having, then you can manage it. So we can even give topical agents like antihistamine, because sometimes they have some bit of itching. So you can give antihistamine. You can do cold compresses, to give the eye some sort of comfort, and also can give something called the artificial artificial tear eyes. So these artificial tear eyes help, in lubricating the eye and help in helping the patient. So there's no specific treatment with regarding the viral conjunctivitis. What happens is that sometimes, because the symptoms kind of is similar to the bacterial one, so most likely when people tend to get any eye drop, mostly the bacterial one, and instill in their eye. And this studies have shown that, it's just like cold. Once someone has cold we know is a viral infection, so there wouldn't be any scientific sense using antibacterial agent for it. So usually we don't want to prescribe an antibacterial agent. We don't want to give any agent specifically with the viral conjunctivitis. So we want to manage it symptomatically, like I said, giving the antihistamines, giving the artificial tears, and doing the cold compresses to get relief. The disease, we say, it is self-limiting. So within the period of 5 to 10 days, you are most likely, the body will fight on its own, and you are most likely to be fine. So
okay. So what if, can it be chronic though?
Yes, we can have the chronic infection. Usually with viral conjunctivitis, you can have it. The symptoms is such that, like I said, for about 10 days you should get some relief. But when it usually goes beyond 4 weeks, then you can have what we call the chronic conjunctivitis, or the viral chronic conjunctivitis. In that case, you can see your specialist, the ophthalmologist, to look at you and see how best they can manage and treat you.
All right, do not wait for it to get to the chronic stage before you run to the hospital. Quickly go see doctors at Tema Christian Eye Center. They'll be more than happy to take care of you and treat your viral conjunctivitis or your Apollo. They are always there, open arms, to take care of all your optical needs. All right, so Doc, I know this sounds very, very exciting, but it's actually time for our social media questions. And the first question is, I heard urine can be used to wash the face in the event where someone catches Apollo and it will clear it. Is that true?
Okay, I would say that is not true, because there hasn't been any scientific evidence that shows that when you use urine to clean your eye, you are going to get some relief. And it's not as if the urine contains some antiviral agents or antiviral property that's going to help you. So studies have not shown that urine can give benefit with regards to viral conjunctivitis. So it's something that our advocates or advise the public to desist from.
In chatting, in your Apollo, it's not going to take care of it. Please see an ophthalmologist or go to Tema Christian Eye Center. All right, the second question is, can I get Apollo by staring at the face of someone who has Apollo?
Okay, well, with this question, although we are saying that viral conjunctivitis is highly contagious, although it's highly contagious, if I just stare at you, I won't get it. But I have to come into direct or indirect contact with the secretion that is coming from your eye. These secretions is what contains the virus. So if I'm coming into contact with it, not directly or indirectly, then I could expose myself of getting it. But once I'm just staring at you and I've not come into direct or indirect contact with it, then obviously you're not going to, I'm not going to infect myself just by staring into your eyes.
I think that's definitely a myth in our society, but I think the moral of it is basically not to get closer to somebody with viral conjunctivitis. But I'm very happy that you did say that, if you have it, that don't mean that that's the end of the road for you. It can be managed or it can even go away. But do not wait, please. Do not wait till it gets to stage 4, where you definitely need more severe care. Always, if you're not sure, speak to your pharmacist or go to Tema Christian Eye Center, and they'll be more than happy to take care of you. All right, so Doc, what's your final words on this topic area?
Okay, so my final words is that the eye, is a very delicate organ, one that we must take very good care of. And because today we are looking at viral conjunctivitis, what happens is that we have other types like the bacterial, the allergic conjunctivitis. So usually the symptoms are very similar. So you may think that it's a bacterial, you may think that you may have a viral conjunctivitis, and you may think that it is one that is being caused by the bacteria, and you go and use an antibiotic which may not be very good, okay, and can even even bring about resistance and also complications. So what happens is that once you have, some of these conditions, usually we see them in our pharmacy. You walk into your pharmacy, you talk to your pharmacist who can able to assist you. It is something that is beyond him. He can always refer you to your ophthalmologist for anything. So once you have the Apollo, do not sit at home, do not use things like urine, do not use anything that you think may help you, but then walk into your pharmacy and you'll be taken care of, or you'll be referred to a specialist, in this case an ophthalmologist, to look at you. So the eye is an important organ, so I'll urge each and every one of us to take care of ourselves and not to instill anything or not to put anything that you come across into our eyes, because it can be very detrimental to our eyes. So that is my final word I can say concerning.
Thank you so much, Doug. It was a pleasure having you. Up next is Dose for Healthy Living. Stay seated.
Today on Dose for Healthy Living, state your allergies. If you have any allergies, tell your pharmacist or doctor before they start you on new medicine.
Okie dokie, this is where we draw the curtains down for another exciting episode. Remember, this show was brought to you by Dragnet, your #1 online pharmacy. Download the Dragnet app on Google Play Store or the App Store. Order all your medications, speak to a pharmacist, upload your prescription, and have it delivered to you wherever you are. With Dragnet, you are assured of quality, convenience, and affordable drugs. Dragnet, your #1 online pharmacy. This is also brought to you by the Pharmaceutical Society of Ghana and Tama Christian Eye Center. If you're looking for a place to go that can cater for all your eye care services, Tama Christian Eye is the place to go. They have skilled and experienced doctors that are always there with exceptional customer service, there to make sure that you get the best treatment you need. Tama Christian Eye is located adjacent to St. Paul Methodist Church at Tama Community 1, or you can call them on 024-371-7468. Tama Christian Eye Center, changing lives through proper eye care. This is also supported by VC4, the best vitamin C plus zinc from Samus Pharma. Boost your immune system with the best supplements from Samus Pharma, and you will thank me later. Many thanks to our media sponsors, ETV Ghana and GH1 Television. Like I always say, whatever that goes in you is merely irreversible. Please always ask your pharmacists. They know best, and they are the professionals that can help you stay fit and to make sure that whatever that you are taking is best. My name is Peggy Sano. I'll be coming your way same time next week. Until then, be safe, and it's bye-bye for now.